Today I have with me Jenna Richardson from Princeton Integrative Health. Jenna, tell me a little bit about yourself.
So I am what I call the Chief Energy Officer of Princeton Integrative Health. I used to call myself the Chief Everything Officer, but I liked the energy portion better. We are a full service integrative medicine, functional medicine clinic. I found functional medicine because my background actually is not medical at all. I'm not a doctor, but I worked in the area of international business and management consulting for a very long time. And when I had my son Carter almost 11 years ago, he had some strange health symptoms that no one could figure out exactly what was going on. We hopped around from doctor to doctor, therapist to therapist, and finally ended up in a doctor's office that was listening to my mama bear instinct that something was going on in his gastrointestinal tract. He prescribed a medication, went to pick it up. Carter stopped eating for an entire weekend. He was a baby, he was an infant at the time, he wouldn't even breastfeed. So I called that doctor back. I said, he stopped eating. What should I do now? He said, oh, don't worry about it. I'll call in another prescription. So I went back to the pharmacy, first time mom, to pick it up. And the pharmacist said, how old is your son? Is the date of birth on the prescription accurate? And I said, yeah, he's 6 months old. Why? And he said, well, this medication is severely contraindicated for kids under the age of 2. He could stop breathing and die. So it was at that point that I, again, with management consulting background, I was working with large corporations to figure out inefficiencies, root cause inefficiencies and process inefficiency and all of those things. And I was like, well, why is our medical system not doing this? Why are we just trying to throw, a medication, a prescription medication at a 6-month-old baby rather than trying to figure out exactly what's going on here? So that was when I dove down the rabbit hole of functional medicine.
How does functional medicine differs itself from traditional medicine?
Yeah, so the way that I best describe this is using an analogy. So it's kind of like you have a house and the shutters are falling off and the shingles are falling off and the foundation is cracked, so the house is leaning to the side. The conventional medical approach would be, okay, let's look at those items as symptoms and prescribe a medication to fix that. It's like climbing up on a ladder and taking your hammer and nails and hammering and nailing the things back on and just kind of hoping that they stay up there. Our approach, so that's top down, our approach is more bottom up. It's let's assess that foundation, where it is cracked, either repair and or re-pour that foundation so that we can build a strong fortress on the top of that. Now, our approach to doing that is really a phased one, right? Starting at the foundational level of energy. We don't think about the fact that our cells are very important in supporting everything else that goes on in our body. So we look at things like mitochondrial energy production. We have modalities in the clinic like hyperbaric oxygen therapy, cold laser therapy, ozone therapy, these things that help the cells to function better, to produce the energy that we need in order to then provide our systems and our function to be optimal ultimately. So we look at things like energy, we look at drainage and detoxification, we look at whole system immune support. We want to make sure that the body is working holistically. It is a very complex biochemical machine, and we need to assess and evaluate and treat it as such.
So tell me, what is exactly functional medicine? Because a lot of people probably have heard it, but they're not exactly familiar with it.
Yeah, so functional medicine is, a lot of people say, oh, what you do is revolutionary. And I say, actually, it's not. It's more evolutionary in that what we're doing, rather than, again, identifying a symptom or a diagnosis to then treat with a medication, we're actually trying to figure out the why behind the body, the why the disease process is occurring or the dysfunction is occurring or the symptom is occurring. Because it's our fundamental belief that the body desires to be healthy, well, and balanced. And oftentimes it's just figuring out what is the root cause of the dysfunction that's causing the imbalance, that's causing the symptom, and then removing what I call removing the noise. Figuring that out, fixing the problem. You can't fix a problem you don't understand. And then setting people up on a path toward optimal health and well-being through therapeutic interventions like nutrition and lifestyle and stress reduction and movement and supplementation, those types of modalities.
So how do you do that? How do you diagnose? How do you find these conditions? How do you hone into that?
Yeah, so it's a very consultative approach. We spend about 60 minutes with patients really trying to understand them, their health history, what's occurred over their lifetime, because what we understand is that disease and dysfunction doesn't happen overnight. It tends to be a cumulative process. So a lot of conversation, a lot of deep digging. Sometimes I even refer to it as health detective work. It's the peeling back of the onion. So between an intense dialogue, asking the right questions, and then really comprehensive lab testing. So we're looking at things above and beyond just your standard like CBC or CMP. We're looking at micronutrient status. We're looking at full thyroid panels. We're looking for autoimmunity in some circumstances. So it's knowing what to look for of modalities like stool testing and saliva testing and urine testing, to identify, does the person have what I refer to as the 3 T's, which are toxins, triggers, and traumas hanging out in their body that are just causing chaos.
And then after that, after you do all this diagnostic, what does the plan look like?
Well, it's always individualistic. So we're treating the person, not the diagnosis, not the symptom. So, everything we do is very precise and very personalized. And again, leveraging things like nutrition and lifestyle intervention and nervous system regulation and supplementation. We will occasionally leverage prescription medication, but more often than not, we're trying to get people off of that path. Because again, we know that the body is capable of being healthy and well. It desires to be healthy and well. And we just need to give it the right inputs to do that.
Are there misconceptions about functional medicine?
It's an interesting question. I do think the paradigm is shifting. I think that, people have been very geared toward our conventional healthcare system, which is that symptom diagnosis medication. But I think what they're starting to recognize, as I did almost a decade ago, is that doesn't work. It doesn't always work. Now, that's not to say that it's not needed in some circumstances, 100%. But it should not be the go-to, right? We are truly responsible for our own health and well-being. I think we've put a lot of that responsibility on the healthcare system where it should never have been, right? So our goal really is to engage with people, educate them, encourage them, and empower them to truly take back control of their health and well-being.
So if you had a word of wisdom to leave the viewers with when it comes to functional medicine, what would that be?
I think it's a word of wisdom more about empowerment. It's about the fact that there are choices you can make. We're not just dealt with the hand that we're dealt. There's this whole study of epigenetics about how what we eat and what we do and how we live our life can truly influence our health and well-being. So I would tell people you are in control of your health. Take back that control. Have self-leadership around that. Ask the right questions, be your own advocate, do your own research, and make the decisions that are best supportive for you.
We are living longer, but living better is truly the key. As you can see, there are so many resources out there for you to live a longer, healthier life. If you'd like more information about our guests, please check out our hyperlocal directory. Thank you for watching, and please remember, like, follow, and share.